Good morning, everyone. We are here with Dr. Nitesh Singh, who's a urologist consultant in Apollo, Chennai. We are going to be talking about him with treatment options for ureteric stone or kidney pipe stone. So, let's get started.
Hello everyone. Well, the treatment option for kidney pipe stone or ureteric stone are many. It all depends on the size of the stone, location of the stone, how obstructive the stones are, and what are the symptoms the patient is having. Let's see. If the stone is very tiny, usually less than 5 to 6 mm, most of the time, if the patient is afebrile, that is not having any fever or not having severe pain or obstructive features like severe hydronephrosis, most of the time they can be managed with medicines, what we call as medical expulsive therapy. Here we give a drug which helps in expelling the stone out. Remember, the flush therapy which was used in the past by many physicians is to be condemned. It should not be encouraged because there is a fair amount of chance of fornicial rupture or kidney rupture with flush therapy, where we give large amount of fluid with diuretics. It should not be done. You can very well drink water instead of that. So the number one is medical expulsive therapy. If the stone is fairly large or it is causing some amount of obstruction, the pain is more or fever, then probably the patient needs stone removal. If the fever is very high, then probably we just stent the patient and remove the stone at a later date. But if there is no fever and only patient is symptomatic, then stone removal is indicated. In that we usually do is ureteroscopy. What we usually do is we insert a small scope with camera attached and we see the stone there. And with the help of laser, we pulverize the stone, make it into a small fragment and retrieve it. Most of the time we insert a small plastic pipe, what we call a stent. Usually we remove after 3 to 6 weeks depending on the patient condition. The next line of treatment is flexible ureteroscopy, which is usually preferred for the stone which is very high up or inside the kidney, not for lower ureteric or mid ureteric stone. Here the scope is little flexible, so many times when we are breaking the stone may get migrated inside the kidney. In those cases, this flexible scope helps that it can bend a little bit so that we can go inside the kidney and we can break the stone with the help of laser. One non-invasive form of therapy is extracorporeal shock wave lithotripsy. Usually it is done in small stone less than 10 to 15 mm depending on the obstruction. Some patient may need pre-stenting before doing ESWL to prevent pain, stent stress, or in case if it is impacted to release the impaction. In this, there is an ultrasonic wave which is given from outside, which gets focused onto the stone and we break the stone into small pieces. The stone usually pass out as small pieces in the urine over a period of time. Sometimes this procedure may need second sitting or third sitting depending on the hardness of the stone. So you need to consult your urologist whether the stone is suitable for ESWL or not. The other form of therapy for very large stone is ureterolithotomy. Usually it is not done very commonly now because of the presence of laser and various other instruments, but it is a very important tool in urologist armamentarium. Here we either make a small incision depending on the location of the stone and remove the stone directly, or it can be very well done with laparoscopically, where we make few keyhole size a hole in your belly and we remove the stone in toto. It's a very effective treatment for very large stone, probably more than 2 to 2.5 centimeter in ureter. Most of the stone in ureter can be treated endoscopically. So consult your urologist in case if you are having a ureteric stone, because ureteric stone can destroy the kidney, can make it non-functioning. So early and effective treatment can save the kidney. So consult the urologist in case if you or any one of your near one is having ureteric stone.
Thank you, Dr. Nitesh, for this important piece of information about treatment options. Thanks again. Bye.
Thank you.